Hey, Pusinet, new video. Sorry, I've been on the road for a little bit and working extra shift. That's what happened when you're a princess and you have expensive hobbies. But so I'm just coming out of a night shift, so that's where it's coffee, not beer this time, and I got those crazy hair going on. But I wanted to do a quick video. I'm going to try to do two. Unfortunately, my camera is not working so well, so I'm going to try it again on the Mac. Last time though, it was looked like a old ninja movie or kung fu movie, but the audio doesn't. But hopefully it will work this time. I try a different thing, as well as yeah. So I wanted to do a little video on wound, and I will try to do one on hypothermia. I'm trying to get back into medicine now because I did a lot of survival stuff lately and outdoors, and so like videos wise. So hopefully I'll get back into medicine, which is my main passion. This one will be on wound care a little bit. I mentioned in past videos, I went to a conference. Was excellent, learned a lot of stuff. I got some contacts and stuff, and it's starting to change a little bit my philosophy of what I carry and everything. Actually, I'm going to try to do a video on my new first aid kit, which has all those new dressings, but there's a bigger video coming on wound care, just like wound care with a specialist. Obviously I'm not an expert. This is more like on opinion, but opinion based on evidence based and stuff that I've learned from other experts and by reading and everything. And again, if you apply any of that stuff, that I'm not consulting, I'm not giving it's my opinion, and it's just for pure information. If you're using it for stuff, well, it's at your own risk. Just like most of the stuff here, it's red. Be careful that the content can be hot. So in this land of lawyers, unfortunately, this happens. Cheers. Okay, so wound healing. The reason I'm doing this video is because watching other YouTube stuff, there's a lot of things that kind of get confused and everything, and at the bottom I'm going to put a list of definitions of different products that are out there that to use. And the reason I'm putting this is because a lot of time you listen to people and they seem like they interchange it, like there's no confusion about it, and there is different categories of different products. And so before you buy anything to put in your first aid kit, be sure of what you know what you're buying. Because, for example, wound care wise, for example, alcohol. Alcohol is great on skin. For example, to intact skin. So, for example, before I start an intravenous, I'll use alcohol swabs on it and put my intravenous, and then decrease my chance of contaminating my wound, because it kills pretty much almost everything that is on, and that's why hand sanitizer are made mostly of alcohol. But I would never, almost never, not almost never use the alcohol product on a wound, because of the reason of using it would be almost there would be no use to it, and you'll see why a few concepts that I'll explain today. But and it would hurt like hell. It would be almost more damage than it does any good. And this is another point I would like to bring, is that a lot of things sometimes traditionally people will say, well, we've been doing that for 100 years, or our ancestor used to do that, and it may have some validation to it. And actually I'm looking, like I'm enjoying reading about that, like old medicine from First Nations. I think they had something there, but the only issue with this is that before about mid 20th century, or even the 20th century mark in the history of medicine, everything was done almost like, oh, that seems to work, we'll do it. And then at one point they were like, oops. Like, for example, if you look at the treatment of syphilis at the beginning, before penicillin was used, they were using mercury. And actually, the mercury was doing more damage than actually any good. And it was, yeah, okay, the syphilis was cured, but now people were having mercury poisoning and dying of mercury poisoning. So what is the best? And so medicine base is where the new medicine is, kind of new trendy words that we have us medical geeks. And basically what it means is that before they try any product or something, even if the concept seems good, we need to prove it. We need to prove that this works. And then this was the studies and all the different studies. And even those, you have to be careful, because sometimes statistic, you can make them say what you want. And so there's a lot of debate sometimes because this study showed this, but this study didn't show that, or whatever. So if you look at people that sometimes on YouTube says that, well, you know, they were using, for example, pine sap for wound closure. Okay, but did they study the risk of complication? Did they study this? Well, no, because back then they didn't do stuff like this. So maybe it worked for one person, but maybe the kind of wounds that they have is not appropriate. It was not the same wounds that you have. And so right now, with wound evidence base, you can say with this categories of people we have proven that this works, and this category, the same treatment wouldn't work. So for example, alcohol, well, providine is even better because at certain concentration it is safe to use on over the skin and everything, and this has been proven. Inside the wound, there's big debates and depend on the concentration, what kind of wounds, where you are in your healing process. Some it works, sometimes it wouldn't work, sometimes it would do more damage than life, but it's the same product, but it's just it depends on where it is. And so it's really important to understand that first concept. And this is yeah, and so today what I hope that I'll be able to do, and I'm seeing already the 7 minutes being blah-blahing, but it's kind of really important that I want you to understand this. And at the bottom, like I said, I'll have a list of all the different lists and stuff. And that I want to make sure that if you understand a concept, then you can improvise and you can apply it, because it doesn't mean that you're going to become an expert in wound care in one YouTube video, and this is impossible. Even me, with 12 years of critical care nursing, I'm not even near what those people knows in wound care. And even those people, despite like their course and stuff, acute care, like I was talking about, oh, I'm doing a lot of wilderness medicine. They never, some of them never even heard the term wilderness medicine. They even clued in that, oh, yeah, there is one in wilderness, and some dressing may be able to apply. And so I'm working on that project actually on the side, and hopefully we'll get something. But there's some people that weren't even considering that it could be a good use for wilderness medicine. So it is, I think so. And so we'll stop there for kind of an introduction. I thought I want to do it one video, but and we'll continue after that with little signs on how to recognize. Well, first of all, what is a wound and how a wound kind of heals, and as well as how does the continuum of wound healing. So see you in the next one.